My name is Tracy Gant, and I'm the mayor in the town of Edmonston.
Hi, I'm Rod Barnes, the town administrator with the town of Edmonston, and happy to be here tonight to talk about this important issue with our distinguished panel and co-host with Mayor Gant.
Thank you so much, Mr. Barnes. Tonight we have with us our panelist, Dr. Lois Wessel, DNP, FNP, BC of Georgetown University, School of Nursing and Health Services. Let me give you just a little background on Dr. Wessel. Dr. Wessel is a professor at School of Nursing and Health Studies at Georgetown University. She practices clinically at CCI Health and Wellness in Silver Spring, Maryland, with a focus on immigrant and refugee health. She is bilingual, that's English and Spanish, and is involved with numerous community and environmental health programs, including the Mid-Atlantic Center for Children's Health and the Environment, Migrant Clinicians Network, and the Alliance of Nurses for Healthy Environments. She was a Duke Johnson & Johnson Nurse Leadership Fellow and conducted research on the topic of the built environment during the fellowship. She is a member of the editorial board for the Journal for Nurses Practitioners. Once you hear from our panelists, they will give you more insight on their background. Mr. Barnes?
Mayor, we also have with us Ludine McCartney Green. She's an attorney and manager of family advocacy at the Green and Healthy Homes Initiative. She is a tremendous legal and litigation skills for representing families in courts throughout Maryland on landlord-tenant matters, with an emphasis on housing and lead poisoning prevention law. Her role also includes advancing housing policies and legislative initiatives here in Maryland. She has testified before the Maryland General Assembly Committee hearings and has appeared as a speaker at numerous events, including the Maryland Judiciary Self-Help Conference. Ludine is a passionate person about addressing health equities and social deterrents of health that impact children and their potential lives of ability to have a healthy life. She holds a Bachelor of Arts in Political Science Pre-Law from Michigan State University and a Juris Doctorate from Michigan State University College of Law. She has over 8 years of legal experience and has worked for several law firms in private practice here in Maryland. We're very happy to have Ms. Ludine McCartney Green with us tonight. We also have Mayor Dr. Jim Conti. Dr. Conti is from Georgetown Washington Hospital Center for Family Medicine. He's a third-year resident, and I know a busy person as we've worked on his schedule. So we're glad to have him here with us. He graduated from Temple University School of Medicine in Philadelphia and is involved in community outreach and public health efforts in the area. We're thrilled to have each of you with us tonight as we talk about this important topic.
Thank you, Mr. Barnes. Again, this will focus on children's health and the environment, asthma and lead poisoning. The meeting will focus on the connections between children and the environment and how the exposure to harmful substances in the air, water, and soil can negatively impact their health. Because children's bodies are developing and because they eat more food, drink more water, and breathe more air for their size than adults do, they are especially vulnerable to environmental health hazards. Mr. Barnes?
Our panelists will give us further insight into two of the environmental health issues most frequent in children, asthma and lead poisoning. We will be learning about ways to identify these conditions, reduce exposure to lead and asthma triggers, as well as some of the current programs that can help parents deal with these conditions.
Fantastic. Well, let's get on with it so we can get into this discussion. Our first segment will be background on environmental issues affecting our children. So my first question would be, What are the health problems children can face due to environmental issues?
I'm
Dr.
happy to
Wessel?
jump in here and then let
Yes.
Dr. Conti follow up. I mean, it's a pretty broad question with a lot of different answers depending on what the environmental issues are. But I think speaking about asthma and lead, we can really focus on two key things. And one is that lead is a neurotoxin, meaning that it's poisonous to the brain, and so it can affect it can cause children to become, in fact, brain damage, lower IQs, problems with impulse control, a number of things which make not just for a tough childhood, but they carry that with them into adulthood. So children who are exposed, as you brought up, Mayor Gant, at the beginning, with their little tiny bodies, a little bit of lead goes a long way. And so if they have a little bit of that exposure and it's not caught on time, or we don't remove that toxin from their environment, it can go on to cause many problems, including um, uh, brain damage to the children. And that's our big concern. And I think it's important to point out that in the course of my lifetime, and my father was a pediatrician who spent a lot of time working on lead poisoning issues, we have seen what was considered the acceptable lead level to come way down. It used to be in the uh, way up in the 70s that we considered a blood lead level of 70 was considered safe. And through my lifetime, I've really seen it come down to now we're thinking that 5 is a safe level and we want kids to be under 5. But I think that as we are constantly learning more research, I think that we are um, knowing that that level 5 may be too high, which is why we need to test children early and often. I know in the District of Columbia, it's 2 lead tests by the age of 2. Um, and then on asthma, I think there are many things, and I'll let Dr. Conti talk more about that. But one of the main issues, COVID aside and home remote learning aside, is asthma is one of the biggest causes of school absences of children. And I think often it's unfortunately a complicated issue of health literacy, where asthma can and should be well controlled with a variety of different medicines. But parents get confused on which inhaler to use when, or they think it might just be a episodic problem that goes away. And the chronicity of asthma and having asthma that's not well controlled means that if kids are missing school, I think it's important to point out that parents are also missing work. In many of the families in a town like Edmonston, the parents can't telecommute. Um, they're frontline folks who need to go to their jobs, and every day kids not in school, that's learning they're not getting, and that's a teacher who knows them and cares about them, or a school nurse who's helping them understand their asthma who's not seeing them. So I think that that's one of the biggest problems that we see with asthma, is poor control leading to emergency department visits as well as missed school days.
Right, right. Thank you. Dr. Conti?
Yeah, I'd like to agree with Dr.
Wow.
Wessel. Both of these issues are things we are very on top of in the medical field, especially protecting our children from, exposures to lead, and to identify and prevent asthma attacks from happening through the use of identifying triggers,
Mhm.
and providing medications that will help, um, you know, both prevent and control asthma attacks. Um, I think Dr. Welsler did a very good job of kind of summarizing the biggest issues that come about with exposure to lead and with exposure to any triggers that may cause an asthma attack.
Right, right. That's great. Great information.
And Mayor, just to piggyback on the other panelists, I just wanted to really highlight that lead poisoning is the #1 environmental hazard affecting children.
Mhm,
The number
mhm.
one. And now that we're in the amid COVID, children are now spending more time in their home, more exposure.
Mhm,
So when
mhm.
we think about that, obviously we're in a heightened time frame where there's about 30 million unhealthy homes in the United States, and with COVID compacted on that, that environmental risk factor is even more more multiplied at this point. So just to keep in mind that's still number one. Unfortunately, it's 2020 and we're still talking about lead poisoning. We've went through the Flint crisis and we're still talking about lead in water. So just for people that are watching and thinking of why lead, why does that matter? It is still a concern and still affecting many children here today.
Right, right. I just wonder if we're getting the proper information about lead.
Well,
You
I
know,
think Ms. Green brought up a really important point that
yeah,
lead is an environmental hazard in the home, and kids are spending more time in the
in
home.
the
And I
home.
think we used to simply think about water problems, and Flint was a very unfortunate example of water in lead. And we used to think about old houses with chipped paint and kids crawling on the floor and getting paint dust in their toys, and it is a normal thing for kids at a certain age to put things in their mouth. I think it's another piece that we've focused a lot on and seen a lot of issues at the Mid-Atlantic Center for Children's Health and the Environment on is with some of our um, refugee and immigrant families. They bring herbs and spices from their home country, or they use herbs and spices that they buy in the whatever the equivalent of their bodega or their little neighborhood store is, that may have lead in it. Unfortunately, we've seen a lot of use of kohl or surma, which is eye makeup that some of the Middle Eastern populations use um, for infants, boys, and girls, and it's a cultural custom to do this to ward off bad spirits. But the eye is a mucous membrane, and the eye makeup they bring from their country of origin has lead in it, and so the kids are getting lead absorbed through the eyes. Um, we
Good,
see a
good
lot of
points, Dr. Wessel. One of the things I think we don't want to forget about is we need to also talk about the symptoms. You're talking about your eyes impacted, and so please expand on that and make sure all of you give
well,
out what those
yeah.
symptoms can
Well,
be.
unfortunately, part of the problem is kids small children who have elevated lead levels often show no symptoms. They may be anemic, but there's many, that's not really a symptom, that's a clinical finding. So the problem is it doesn't show symptoms, and that's why we need to do the testing. So it doesn't affect the eyes themselves, but it gets into the bloodstream. So the point is there may be many sources of lead in the home, cheap, cheap jewelry from, bought in a little dollar store, or pottery, brought from their country of origin, some different kinds of dishes. So or the family may do something like go fishing, which is a pretty healthy hobby, but the weighted fishing rods have not the rods, the lures. Um, they may be made of lead, or if a parent works in something related to the armed forces or the military or the police or something that's not legit, they may have lead dust on their clothes from ammunition, and then they cuddle a baby. And so my point is that there are many sources of lead beyond paint and water that we have to make people aware of.
Very good. So is there a treatment for the poisoning? What happens? What does a
I'll let
child,
Dr. Conti
how does
answer that.
a child get treated, Dr. Conti, if they're exposed to lead-based paint and their levels are elevated?
Yeah, absolutely. So, the first step is, as Dr. Wessel said, identification. So every child at the age of 1 and at the age of 2 will typically receive a blood test looking for their blood levels, their hemoglobin, their hematocrit, to see if they are anemic, but they will also get a lead level with the cutoffs, as Dr. Wessel described already. If we identify that they're above the minimum allowable concentration of lead in the blood, we can give a variety of different IV or oral medications aimed at absorbing some of that lead into the chemical and allowing it to pass naturally, either urination or having a bowel movement that would allow the lead to naturally be removed from the body. In some cases, if the lead is dangerously high, well above our minimum acceptable standard, it may require IV medications in a hospital setting in order to prevent serious toxic events that may be life-threatening in the moment. We typically think about that when blood levels are significantly low or the blood lead level is significantly high, and we're already seeing issues where a child is very tired,
Mhm.
which really raises a severe concern that the blood levels are so high that they're producing almost immediate symptoms.
Mhm.
Okay, all right.
Oh.
Very interesting. Before we go off to asthma, I had a question about, are children tested for lead, and is that one of the requirements to get into a school?
Yeah. And I
Yes.
think the point that Dr. Condi brought up that's really important is this testing at least twice, this at age 1 and age 2. And for our refugee children, we test them regardless of what age they come. Um, but one of the things that we're seeing as every other medical and social problem is compounded by COVID, we are concerned that parents often worry, understandably, about bringing their kids to a medical setting during COVID because they don't want to be in the waiting room with people that they might get COVID from, or that they think they might get COVID from. And so we may not be doing this screening. And just like every other environmental problem, and something that I know Green and Healthy Homes works on, is first of all is prevention, and secondly it's early detection. So if we get a kid when they're 1 and they have an elevated level, we're probably not having to send them to the hospital to get IV medication. We might be able to find the source in the home, and keep an eye on that kid and do follow-up leads and do some dietary changes and increase the iron in their diet, and maybe turn it around. So we don't want people to think that because of COVID they shouldn't come in and get their general pediatric care, which of course includes immunizations as well.
Very good.
And Rod, just to highlight, Dr. Wessel mentioned the fact that of case management, right? That early intervention is really what's necessary so we don't get to the high levels. But I want to remind citizens of Edmondson or Prince George's County, roughly about 300 children are poisoned by lead every year in the county. I'm not talking about a different state. I'm talking about somewhere. I'm talking about in Prince George's County. And we talk about different sources of lead. Lead paint will be your number one, but especially in the county, the spices or makeup have been one of the determining factor of seeing that in children. Most recently was also found lead in soil in playgrounds.
Mhm.
So, and I'm talking about right here in Prince George's County and nowhere else. So when we talk about educating, the low levels is really where a lot of children are being tested and found. And if we haven't said it, I want to say it now, and I'm sure Dr. Conti and Dr. Wessel will basically agree that there's no safe level of lead.
Mhm.
Right? CDC has made that known. There's no safe level. So if you're testing even at a 2, at a 3, at a 5, I tell parents all the time, don't dismiss that, right? Don't say, oh, my kid is fine. Still look into that and look into nutrition, of how you can increase that nutrition so your lead levels can go down. Thank you, Rod.
Very good. No problem. That is important. And communities, towns can help. The county government can help. The state government can help, especially with those playgrounds, with making sure when we do inspections on homes that we're checking for those kinds of issues, making sure that the children living in the homes are being tested. So, Mayor, I think we want to talk a little bit about asthma.
Yeah. Before we go into our next section,
So, Mayor, you're on mute.
before we go, thank you. Next segment, I don't want to miss the opportunity to explain what is asthma and what is lead poisoning. If we could quickly just answer that question. I know Dr. Wessel talked about asthma, but anyone can answer that question. What is asthma? What is lead poisoning?
Yeah, thank you, Mary Gant. I'm happy to answer that question. So we have talked about lead poisoning just now in good detail, but asthma is a chronic lung disease that's characterized by inflammation in the lungs that often causes constriction of the individual airways, leading to air trapping, and the main symptoms, which are coughing, difficulty breathing, pressure or pain in the chest, and what we call dyspnea or difficulty maintaining adequate oxygenation. It is a problem that is also environmental because of what children are exposed to, what sufferers of asthma are exposed to. There are specific triggers, for example, pollen, dust, animal dander, but even things like just cold weather or certain chemicals, perfumes, soap, shampoos, air pollution can set off an asthma attack. And so it's important to identify triggers that may cause asthma attacks in order to help understand a child's risk for developing severe asthma attacks at home, at school, out in the town, in order to prevent, severe, as Russell said, losses and absences from school, but, hospitalizations, emergency visits, and, in its most severe untreated forms, loss of life.
Doctor, is it especially difficult right now with the COVID situation because many of the symptoms that you might have with the difficulty of breathing could be attributed also to COVID and what the reaction from the parents should be as a result of asthma, being aware of knowing that their child has an asthma problem versus a COVID problem?
I think that's definitely true. I mean, any of us, if we get the sniffles, we all wonder, is it COVID? Um, but I think the main point here is if you are a child with uncontrolled asthma and you do get COVID, you already have your lungs are already compromised and your breathing is already compromised. And the stories we hear about COVID is people can get very sick very quickly. So this is a kid who could go downhill pretty quickly. And as Dr. Conti said, we don't want loss of life here. So it can be um, very confusing to have the two things at once. I think it's also important to point out, and I know that again that Ms. Green and Green and Healthy Homes works on this, is to look at ways that we can talk about trigger reduction in the home. And one of the reasons that lower income folks have more acute exacerbations of asthma is they may be living in places with mold or cockroaches. No, I don't. I always say to my patients, I don't want you to feel like I think you live in a dirty home and my home is clean. I say, I've seen cockroaches in my home. We've had a mold problem in our home, and these are things that happen. We live in a humid environment here during the summer. Things. These are things that all of us have faced in our homes. So I don't want people to feel like their homes are dirty. But one of the things that we can make a decision to have or to not have in the home is smokers. And there was a piece in the New York Times over the weekend about the increase in smoking during COVID. Anxiety, boredom, all sorts of things can cause something like smoking to increase. And unfortunately for children with asthma, being exposed to secondhand smoke, meaning there's a smoker in the home, or even third-hand smoke. The dad smokes on the couch and the kid falls asleep on the couch and is sniffing that stale tobacco stuff that's in the couch and is breathing it in. That's a problem. So one of the things that I think we always need to think about is appropriate, culturally and linguistically appropriate smoking cessation programs for any parents who may smoke, because there are a number of medical problems that can cause for their children and for themselves, obviously, including exacerbating asthma.
Right. Thank you, Dr. Whistle. I don't want to miss the opportunity before we move on to the next segment to also mention what is lead poisoning. So we talked about asthma, and if we could quickly just identify what is lead poisoning. I just want to be clear on that. We did talk about the symptoms, but we wanted to get the definition.
I guess I would define lead poisoning as having a having any lead in your system. As Ms. Green pointed out,
Thank you.
CDC says no level of lead is safe. So having lead in your bloodstream, we should not have lead. There are
Right.
other metals like iron that we should have, and other chemicals that we should have, potassium. But lead, once you have lead in your system, that is lead poisoning.
That is lead poisoning. Yes.
Mayor,
Thank-
that can be absorbing, inhaling, or, the hand to touch with children. They're
Mhm.
small, they're on the floor. Lead can be on the floor, on the baseboards, and when they touch that and put their hands in their mouth, that's what elevates the blood and causes their be poisoning.
Thank you, because I know a lot of times people think it's just from the paint, but we're talking about our water, and you talked about jewelry. These are things that haven't been necessarily identified before. So thank you so much. We're going to go ahead and move into our second segment, which is the roles of parents and caregivers. Mr. Barnes, you want to start with the question?
So our first question, and I'll direct this at Dr. Conti. What should parents do if they think their child may have been exposed to lead or have asthma symptoms? What's the first steps?
Absolutely. So if this has never been diagnosed before and it's felt that this is a first exposure, then the first step would be to come into a doctor's office, a primary care physician, either family medicine, internal medicine, and be evaluated, whether that be for lead poisoning in the form of a blood test or in terms of asthma with a physical exam, including listening to the lungs and checking the oxygenation. That is generally the first step. Asthma can present in many different ways, as can lead, and the severity is something that we are very concerned about. If the exposure is a child begins coughing, as we touched upon a little bit earlier, then a doctor's office would be an appropriate place to start. However, if there was concern that a child was not able to breathe, had significant difficulty just breathing, wheezing very, very loudly, or coughing very frequently, and just did not seem like was able to get oxygen into their system, then I think the first step would be to go to the emergency room for evaluation and further treatment. Um, and I think that really displays how differently asthma can present based on one's reaction to whatever trigger they're exposed to.
And I would
Um,
add one more thing to that, which I think is important. If you have a child as a parent who's been diagnosed with elevated lead from this blood test that we do, it's really important that your other children get tested as well, because they may not be of that age where they're crawling on the floor and putting everything in their mouth. But if the source is the spices that they're using or the dishes that they're using, you're probably going to see it in the older children as well. So we do this screening of the 1 and 2-year-olds, but as a primary care provider, if I see a little kid with lead, I test the whole family. Um, and that's
a very good point, because absolutely that would be very important. So how can parents and caregivers reduce the exposure to environmental triggers? What are some of the tips that they can do that would make it easier and better for their children that may have as tendency to have asthma or to have the triggers that happen? Because it's a scary event if a person can't breathe and they don't know much about why they can't breathe. It could be pretty scary.
Mhm, mhm.
Yeah, in terms of asthma and the triggers, identification again is one of the first steps. So knowing, what your child may react to, is it cold weather? Is it exercise? Is it dust, pollen, cigarette smoking? There are a lot of different things that can cause an attack and can make symptoms, mild or severe. And so knowing what those are ahead of time. For things like smoking, it's ensuring that a child isn't exposed to smoke in the first place. If a family member is going to smoke, making sure they're far removed and changing clothes before interacting, ensuring that there's no point of contact of cigarette smoke in the child. In terms of dust and pollen, frequently that involves cleaning the home often to ensure that there is no leftover dust on surfaces, that there is no pollen being tracked in from outside. Um, so there are a lot of different ways to reduce that exposure, all of which very, very well depend on what exposure a child requires in order to trigger an asthma attack.
Mhm. And I would add one thing to that, which is we're talking about, we focus a lot on environmental triggers, where there can be trigger reduction in the home, but it's also important to point out that some kids, their asthma is triggered by um, a virus or a bacteria that they get. And we might see a little bit less of these kind of common colds in kids, with kids not being in school right now because of COVID and even simply mask wearing. But because a childhood viral or bacterial infection can then cause an exacerbation of asthma, it's again another reason why children should be getting their immunizations. The small kids, we give them medicine against a respiratory virus, RSV, or pneumonia vaccines, and all of these childhood illnesses can that involve the respiratory system can also be problematic if you have asthma. So getting those vaccines is really important.
And Rod, I want to add to that as well. When it comes to asthma, looking at the environmental factor, right, and trying to rule out certain things. Dr. Conti mentioned smoking. Obviously, first, second, and third hand smoking are all a risk and factor. But you want to think about what can you do in the home. At Green and Healthy Homes, one of the things that we recommend and advise our clients to do is to put a mattress pillow cover over your pillow. Put it over your bed as well. You want to make sure that you have kind of a weekly cleaning. Use a HEPA vacuum. Using a high energy particle efficient vacuum is much better than using a standard vacuum, because it sucks up all the particle that is in the air that may cause and trigger the asthma in the home as well. So we recommend cleaning, sometimes using a 2-bucket mop system, having one bucket that you're using with cleaning with warm water, soapy water, and then another clean bucket. So you're not cross-contaminating if you're wiping up, if it's lead dust that you think that you may be exposed to, or just different dust mites that may be in the area. So proper cleaning, a HEPA vacuum, mattress pillow or cover for the bed are some of the good ways also to look at reducing triggers. And for lead, proper nutrition, right? Looking at things that are high in calcium, looking at things that are high in iron as well. Eat your fruits and vegetables. That matters. I'm sorry. I do have cheat days, right? We all cheat, but we want to practice good, safe eating habits and making sure we're doing that. Washing our hands. We've heard that consistently, right? If there's one thing sing the happy birthday song, sing the ABCs, sing all those songs. Those still matter, so washing our hands. One of the things we also advise our clients to do is to take off your shoes when you're entering the home. Lead dust is sticky and it can stick to your shoes and you can track it in, especially if you're a contractor, right? You've been working on a home. Now you're coming home with your family. It's dinner time. Take off those clothes and the shoes and leave them at the door and not track them inside the house. All those things my mom told me, did not pay any attention to. I am now teaching that to my kids and they're looking at me cross-eyed, but something tells me that they're going to do it when they get older too. Those matters, and those are ways to reduce that.
Mm-hmm.
That's wonderful tips. And what about air filters in homes? Do air filters play a role sometimes in taking out some of those impurities that are in the air?
Yes. From our, when we have our assessors that go in, that's one of the things that they're looking at a air filter, replacing that. I think it's like a 3-month or 90 days. Those are good habits as well. Smoke detectors, right? Making sure that those are still functional and working, and at least on every level. Definitely good tips, Rod.
Very good. That outstanding information. Anyone else want to provide anything else in terms of the inside, outside the home triggers with lead-based paint or asthma?
I was just going to add one more piece, and we certainly should be encouraging our children to play outside for all of the same reasons, like eating their fruits and vegetables. And especially now with COVID, what a better place for kids to be than outside running around. However, if pollen or leaf mold is one of their triggers, sometimes what happens is the kids have a great time playing outdoors. They get stuff in their hair. They put their head on their pillow, they go to sleep, and they're literally breathing in the triggers, such as the pollen. So one easy thing that parents can do in the home, if you know that your kid does have what we used to call hay fever, or now we call allergic rhinitis, that and asthma, that, or even if they don't have asthma but they have allergic rhinitis, just a quick shower or bath before bed to get off anything that might be on their body is really important. And the other thing that I think is really hard for families is that often one of their triggers may be animal dander. And people love to say, "Oh, I have a hypoallergenic dog. My dog doesn't, isn't a problem." And from what I understand, really the only hypoallergenic pet is like a snake or a reptile. But anything that has fluff, like a bird or a gerbil, even if it's not the dander itself of that animal, the dust mites and other things get stuck to these hairy creatures. And so the cat and the dog may be bringing in pollen from the outside. A lot of kids and a lot of families love their pet like a family member and let the pet sleep in the bed with the kids. And so if you know what the triggers are and it is pet dander and or something that the pet may have on them, it's really heartbreaking, but the kids need to be kept far from the pets. And I've seen families where they've unfortunately had to give away the pets.
Very good. We could talk about a lot of this for a long period of time, but Mayor, I believe it's time to move into our next segment. Is that correct?
That is correct. Policy and advocacy. Ms. Green, what are some of the recent Maryland laws that protect our children from asthma or lead poisoning in housing?
Thank you, Mayor. One of the great things of working at Green and Healthy Homes is the connection between working with the family on the ground, but also the policy and advocacy piece. I'm happy to be able to say that last year, Governor Hogan signed into law the Maryland risk reduction and housing law. And what he did was by signing that law, that amended our reference level in Maryland, the action level. You're looking at me like, what's an action level, right? So in the state of Maryland, a rental property owner is required to do a proactive rental inspection prior to a tenant moving in. If the tenant moved in and was exposed to lead paint, whether it's a child under the age of 6 or a pregnant woman, the landlord was required to act to do risk reduction measures to remove the lead paint from the rental property. When did that happen? Only if that child under the age of 6 or pregnant woman tested at a 10 micrograms per deciliter or above. What the new law says, which went into effect July 1st, 2020, that level has been lowered from a 10 to a 5. So if a child under the age of 6, and I'm mentioning that because those are key words of art that the law protects, because we just talked about how vulnerable that age is, and pregnant women is another risk or vulnerable as well. So what that basically did is lower the level. We've now aligned with the reference level that the CDC says as a reference level. Maryland's done that, and there are about 10 other states that have also aligned, and it might actually be more, but Maryland is now there. So happy to say that children are now more protected, getting case management at a level of 5 and above. But what does it mean for property owners, right? What does it mean if you own a property? It means that before, the law was automatically child tested at a level of 11, landlord had to react immediately by doing those risk reduction measures. Now the law says landlord will have to act only if an environmental investigation identifies the paint as the factor that is the source of lead.
Oh.
That environmental investigation can be conducted by the Maryland Department of Environment or the local health departments. Baltimore City and Prince George's County have within their health department a sanitarian or an inspector that will go out and do that. So key phrase I want to mention is that child is in the home or pregnant woman exposed to lead at a level of a 5 or above. The mom and dad or guardian will be notified now at a 5. That was not happening before. Now they will be notified, and once notified, the property owner is also notified. But before the property owner is required to act, the environmental investigation will take place. As we mentioned, there's different sources of lead. Lead paint has been, and it still is, the #1 hazard affecting and causing lead poisoning. But now we're at a point where the state is looking at the levels between 5 to 9 and noticing the different sources, which could be the paint, it could be the spices, and they're going into homes doing that environmental investigation. So that's one thing. And I wanted to talk about just a little bit about the process. A child gets tested by the local health department, and that is what triggers it. I've heard some tenants that says where they feel like they're being retaliated against. I didn't tell I didn't tell my health department that that the child was poisoned. You know, don't kick me out. I want to let parents know that and families know that it is required. This is not, the tenant can put the landlord on notice, or the local health department or state can put the landlord on notice.
That's important. That's very important. Thank you so very much for that. Now, are there any programs, state or local programs available for residents or owners of older housing, considering lead poisoning?
Yeah, so what you should know is that lead paint was banned in 1978. So we're looking at, when we say older housing, it's pre-1978. Any housing pre-1978, the presumption is that lead is there.
Right.
In order to release from that presumption, the state requires you to get a lead certificate. And the lead certificate can be one of 3 different kinds, I would say. Lead-free, meaning that you've removed all lead, both inside and outside of the property. You'll get a certificate that says lead-free, or you can get a full risk reduction. What does that mean? Every time there's a new tenant that comes into the property, there's a certificate that the landlord should provide saying that they did a dust wipe clearance test. What does that say? That they tested the levels in the home, there's no lead dust or visible hazards in the home, and it is safe for tenants to move in. The third certificate is a modified risk reduction. Modified risk reduction means that there was tenants in the home, there was some type of exposure, landlord did complete the lead remediation, got the dust clearance, and received a certificate saying a modified risk reduction was done in the property. There's a lead it's a 2-year certificate, but I won't go into that. I'll give people an opportunity to reach out to me and property owners to talk about that. But I want to tell families that they should know older housing means pre-1978, they should get a lead certificate that the state requires. Maryland is very strong and one of the strongest laws when it comes to lead paint in our state. In terms of program, the Maryland Department of Housing and Community Development has 2 programs. And one of the programs I want to talk about is, it's called Program 1, Healthy Homes, Healthy Kids. And the CHIP funds, CHIP insurance funds that. And basically, if a child has a level of a 5 or above, they're Medicaid eligible, and there's lead hazards present in the home, they can apply to see if there are funding available for a lead inspection and a lead hazard reduction. That's one program. So that's the Healthy Homes, Healthy Kids program. And then the second program is a lead hazard reduction grant and loan program. You have to be a Maryland resident. We have a lot of rentals where people don't live actually in the state of Maryland. They actually live outside, but so you have to be a Maryland resident. You have to own a residential property, and there's no income limits. So you can receive the grant or the loan depending on the income of the property owner. And it's available for homeowners. If you notice when I talked about the Maryland risk reduction law, that was applicable to rental and rental property. This program is also applicable for homeowners. And something I always want to make sure I wheel in, I want to talk about our grandparents. Sometimes grandparents have kids that whether it's their grandchildren, whether they're watching someone's neighbor's kids or whatever. If you have a child in the home that is spending 10 hours or more, they can be exposed to lead and be affected by lead poisoning as well. So dropping off nieces or cousins or grandkids at grandma can also be a risk as well, and can be a source of where they might be in exposure as well. So that program is also available if, like I said, if there's a secondary home where a child spent 10 hours or more there, they can apply for that program as well to see if they are eligible for lead hazard reduction measures in the home.
Wow, that's really, really good information. I'm a grandparent, so I'm concerned about that. That's really good. Thank you so much for that. Now, how can a parent or a caregiver work with a health provider to advocate for their child's health? How can they maneuver that? Either one, Dr.
And I
Weissel
think
or
there are a number of things that
mhm,
that parents can do. Um, One is I think healthcare providers play a role in the sense that we can't solve these larger social issues in the four walls of an exam room. So I think we need to address things and make sure that these things are funded, like the programs that Ms. Green was just speaking about, making sure that those kind of programs know how to access um, trained interpreters and have and know how to deal with issues of health literacy and cultural competency. For example, while we know that putting this eye makeup on children is could be hazardous to their health, I don't want to tell families that their cultural practice is incorrect. So, what one of the federally qualified health centers in DC, they were able to get some funding to give out your basic, I don't know, Maybelline or something from the local CVS or to give to families so they could still continue their practice of putting eye makeup on these children because it's a very important practice that I do want them to keep up, especially being in a foreign country. I want them to feel like they are respected and wanting to do something, but I want to make sure that they do it safely. So it's not simply saying you shouldn't use your eye makeup on the child. It's like, let me give you this one, and this is why I'm giving you this one. This one doesn't have lead in it. Now, that's a lot to put on a healthcare provider when we have a lot to do in a short period of time when we see patients. So I think strengthening the health system with home visiting nurses, community health workers, these are all ways that we can bridge some of the gaps that parents who um, understandably may feel overwhelmed. They're trying their hardest to be the best parent possible. It's not their fault that there's smokers even in the next apartment over. So who's going to advocate for that child who's been in the hospital with asthma when it's not even somebody in the family who's a smoker? What are the legal and medical partnerships that exist? We often look at it as the legal people do this, the healthcare people do that, but we really need to work together, or Dr. Conti and I are going to be seeing these kids, every month or so. So I think the best way we can advocate for the families we work with is make sure these programs are funded, make sure parents have education in a language and at a level they understand and the appropriate resources. Um, for example, one of the things that the Mid-Atlantic Center for Children's Health and the Environment has done is given out to the promotores de salud, or the community health workers of Casa of Maryland. We've actually given them these little lead testing kits, which you can buy. They're probably not as cheap as they should be, but you can buy at Home Depot or any hardware store, and they look a little bit like a cigarette, and you can use it to check to see if your dishes, let's say, have lead in them, or your jewelry has lead in it. And so we've given that to the community health workers to go into the home and work with families to identify what are the items in the home that may have lead in them. And those are things that I wouldn't know about as a clinician in my exam room. I can tell you what the lead level is and what the iron level is and what shots the kid needs, but I don't really know all this that's in the home. So I think we need to be advocates for funding to have more sort of services that can help family look for these sources of lead, or maybe the mold trigger in the home is a leaky faucet and you're an immigrant family and you don't have the language skills, or you're afraid to call the landlord because you're behind on your rent because COVID has affected your job. Having somebody who can advocate for you to make sure that we just get that plumbing fixed so that the sink isn't dripping and there's not mold under the sink. And there's simple fixes to some of these things.
It sounds like, Dr. Wessel, it's all about communication and getting the word out and getting information in the right hands of parents, educators, medical profession, so that resources are known. Ms. Green talked a lot about some of the things happening from the state level. We want to wrap up this session so we can take a few questions. I know that
Mhm.
that we do have some of those, and we want to move right into that. So Mayor, the first question that they were interested in getting answered was,
Yes, yes. We had someone to write into us to ask. I think my child's asthma sometimes gets worse in school. What should I do?
That's a great question. And I'm happy to address that. I think
Mhm.
even if it's not getting worse at school, one of the best things to do when you're at a doctor's office is creating what's called an asthma action plan. And it's something that is provided both to the parents as well as to the school, which allows you to see the severity of the asthma, identify what triggers and what medications are appropriate for specific symptoms of asthma. In addition, when a child has asthma, we generally recommend that the school nurse be contacted and provided an inhaler of albuterol in the event the child becomes short of breath or has other symptoms suspicious for asthma. It allows the nurse to administer some treatment there and then, and evaluate, reevaluate, and potentially escalate care as needed. But making sure that you're contacting both the school nurse, any doctors, practitioners, anyone who is involved in the care of the child, so that all parties are involved and aware of the specific needs of any child.
And the important thing about the asthma action plan that I actually love, kind of going back to what I was talking about before about information that parents can understand, is that it's based on a concept of red, yellow, and green, just like a stoplight. And it's really interesting that that stoplight concept is universal. So if your kid is in the green zone, that means they're doing really well. The yellow zone, it's okay. We want to get them back to the green zone. And the red zone means that there's a problem. So those asthma action plans really empower the parents to understand a lot about what is happening with the kid. And then back to the advocacy piece, school nurses are great. I don't know the situation in PG County as well as I do in Montgomery County where I live, but there may be one school nurse for 3 different schools, which frankly is probably not enough. And again, everything is COVID these days. And if you look at some of the ways that kids were able to go back to school after the pandemic in 1918, it was having a school nurse in every school who could help keep keep things healthy. And so having more school nurses would really help so that those kids could get that albuterol hailer. And what if the kid is in an after school sporting activity, they need their inhaler and the nurse is already gone for the day? How are we going to work that out? So the nurses sometimes can figure out those plans with the family and the school administrators so that those kids can participate in exercise programs, which of course reduce the risk of childhood obesity. And these things often go together.
Thank you. Thank you so very much. I mean, I have enjoyed this opportunity to learn more about lead and also asthma. How about you, Mr. Barnes? Have you enjoyed this? And
I have enjoyed it. And, it actually wants me to take action. I want to make sure that here at the town of Edmonston, we're doing some of these things, that we're making sure people are aware of the resources, aware of what happens. We're checking out rental homes. We have a number of rental homes here in our community. And so how can we make sure that they're lead-based paint safe for our small children, particularly, and for any pregnant mothers that might be in that home. So it's been outstanding. Our panelists are wonderful. We could probably go on talking about this.
And it's sort of like we want so much more.
Yes.
We want more information. And so this has been great.
Yes. Final thoughts from our panelists. Anything that any of you would like to share with our viewers before we wrap up completely here?
You've given us so much. just one little final thought, maybe to a parent or a caretaker or even a healthcare provider. Just one final thought. that would be really great.
And I guess I would repeat what I said before. It's very important, even with COVID, that parents continue to get their well child checks so we can immunize them, especially now with the flu. We can do appropriate tests per their age, including lead, and we can help manage their asthma so they don't end up in the emergency room, hospitalized, or even succumbing to it. So keeping those kids coming into our primary care clinics is the message I would give.
Absolutely. I would agree with that and just say all of our doctors' offices are more than happy to accommodate, and we have strict precautions to make sure that the any risk of exposure to coronavirus is as little as possible.
Mhm,
And the benefits of immunizations, the benefits of regular physical exams
mhm,
very much outweighs the small risk that any doctor's office is going to have of transmission of coronavirus at this time. We
mhm,
take it very seriously and we want everyone to be aware. We do everything that is safe for the patient to make sure that anyone is able to come in safely.
mhm.
Mayor, I have two things. One, I'm going to say parents, go with your gut feeling, right? If you know that something's not right or something doesn't seem right, I want to empower you to speak up. Early intervention is the best thing, just seconding that. And primary prevention are the best ways to identify lead poisoning and to address it head on, including asthma as well. So go with your gut feeling. And two, I'm going to say a little bit off topic, but still on point, complete your census. Today is the
Mm,
last day to do that. And if you have not done
Yeah.
that, I will tell you to complete it because those dollars and those funding help healthy homes. And we want to make sure that those coming back to the communities that most need it.
Yes, yes, yes. Thank you so much for that. Thank you for that. That means a lot. A lot of times we don't understand how we can get our resources, and that census says a lot. So
mhm.
thank you so much. Mr. Barnes, did you have a final thought?
Well, just that this is great information tonight, and it's going to be available. You can sign on to Edmonston's website, edmonstonmd.gov. Drop down to the bottom of the page, click on the Facebook icon. It'll take you right to our Facebook page where this segment is on. We also have it, it'll be viewing on our government access channel here in Edmonston community. And you folks can have it as a resource to tell folks if they want to know more information about um, asthma or lead-based paint. Watch our show. You did a really good job of providing good information for that. So that would be my final shot at this evening, and certainly want to thank each of our guests for spending time with us tonight and working on this very important topic.
Yes, thank you again so much. And thank you, Mr. Barnes. I just want to make mention, besides the information Mr. Barnes just provided, we have Edmonston Talks, and that would be October the 21st at 7 p.m. And our topic for Edmonston Talks is heroes during the pandemic. And I'll just say tonight, we have some heroes here. So thank you so very much for what you do and the information that you provide. Sometimes with everything that's going on, some things get pushed to the back burner. And I think lead based paint or and the ways that you can get lead poisoning and asthma, it's important. And it has been pushed to the side. It gets pushed to the side a lot. Um, some people take it as a common cold, but this is serious. And I thank you so much for providing the information that you provided tonight. You are our heroes tonight. And I know you're heroes to so many that talk with you and meet with you. So thank you once again on behalf of the town of Edmonston. Yep, thumbs up. Thank you on behalf of the town of Edmonston, myself, Mayor Gant. We thank you so much for just giving us what you have. And with that, I'll sign off and say good night. Thank you to everyone again.
Thank you.
Thank you